Hello, this is Dr. Zinker, Bernarda Zinker, with a special edition of a webinar from SpectraCell Laboratories, specifically focusing on prevention and intervention needed in this critical time of the pandemic of the coronavirus COVID-19. We know that COVID-19 is sweeping through the world and sweeping through our country, and SpectraCell Labs and I have joined together to put together some recommendations that could be helpful to our clinicians and therefore our patients as we face the challenges of this virus, and with interventions that we can institute to help survive the virus. So a couple of brief words. I want to make sure that our clinicians and viewers understand that these are my recommendations. I'm a family physician, certified in functional medicine, board certified integrative medicine. These recommendations have not been approved by the FDA, and this is a document for clinicians. I give the doses of supplements that I am using with my practice, but absolutely these doses that are listed should be evaluated and superseded by clinical judgment of a clinician. Doses, as you know, can be affected by a supplement's quality, the concentration, the active ingredients, the incipient factors, many other factors, and the effect of a supplement can also be influenced by our patient's medical history, the milieu of their body. So by all means, evaluate the recommendations that I am presenting based in with your clinical judgment, with your individual patient in mind. When possible, please evaluate the dosing that I recommended based on laboratory results, such as the vitamin D and vitamin A, for example. So with that, please be mindful that these are my recommendations. They are not the recommendations from SpectraCell, but I am using SpectraCell laboratory evaluation and testing for the benefit of my patients, of how I can help my patients prepare for this to the best of our ability, so that we can all be winners at the end of this trial period in our country. A few words about prevention. Absolutely, prevention. Social distancing 6 feet so that we are out of breath range of aerosolized particles. That's how this coronavirus is being transmitted. We need to stay 6 feet, even more 8 feet away from another individual, except for our loved ones for whom we are living. Stay at home. Stay away from other people, social distancing, stay at home, shelter at home. It's a trying time, but it's a time that we can clean out our closets. We can spend more time in meditation and prayer and thoughtful thinking. Maybe make a batch of cookies and stash them for the future. Hand washing, 20 seconds. Warm water is tolerated with a good soap, a disinfectant, antiseptic soap. And by all means, when going out into the public, wear a face mask. We've got to protect ourselves from breathing in the virus through our nose or bringing it in through our mouth. Wearing a face mask, most importantly, helps us to remember, keep our hands away from our face. And when we come back from the grocery store or come back from getting the mail, wash our hands, 20 seconds, wash our hands, or use a disinfectant like Purell to just be on the safe side. So tonight I'm going to be talking specifically about nutritional interventions and why we're using those nutritional interventions. We want to boost our micronutrients. Our whole metabolic processes are based on enzymes. Enzymes require nutrients or they don't work. It's just a simple biochemical principle. You have to have good intracellular nutrients in order for these enzymes to be functioning. So let's talk about how I evaluate and what we need to be looking at when we're thinking about our individual patients. Pull out their micronutrient test, order the micronutrient test, and look at the immune function and the antioxidant function. The Spectrox is the part of the test that evaluates the global antioxidant status functioning of the lymphocytes within a patient. The Immunidex is what indicates the immune function of how well that cell could withstand an immune challenge. We want it to be as strong as possible. Regretfully, many of our patients are in that borderline region or even in deficient region of the Spectrox and Immunidex, and there are simple interventions that we can advise that can make a dramatic difference even in 1 to 2 weeks, dramatic difference even within a few days. And I want to go over some of those nutrient interventions that I am using and that I hope that you will also use. So when we think about the Immunidex, it is the immune function we are looking at. It is the ability to prevent and to fight getting the infection in the first place. I'm going to be talking about 3 nutrients specifically: vitamin D3, vitamin A, and zinc. All 3 of these can make a huge difference in the lives that we are trying to protect. The Spectrox is the antioxidant function. That is the global evaluation. That Spectrox score is the evaluation for the cells and the body to withstand oxidative stress, for those antioxidant enzymes such as SOD, superoxide dismutase, GPX that metabolizes hydrogen peroxide, your GSR, your glutathione synthetase reductase enzymes, for those enzymes, those antioxidant enzymes to work appropriately. And I'm going to talk about just 3 here: glutathione, vitamin C, alpha lipoic acid. And as I go along, I'm going to give you some of the dosing that I use in my practice for prevention, as well as then what would be the dose, expedient dose to increase in the face of an infection. So let's talk about some of these. The first one we're going to talk about is glutathione. Through this conversation, this talk with you, I'm going to be referencing some of the citations from the medical literature that supports what I am presenting to you. And the first nutrient we're going to be talking about is glutathione. We know that glutathione protects against oxidative stress. It is the major antioxidant enzyme of the body, and there are multiple research articles documenting this. From this specific article, we see that glutathione helps to control and prevent the process of oxidative stress through the removal of reactive oxygen species. And it's documented that the cytotoxicity, the killing off of the cell, and the reactive oxygen species generation were reversed by glutathione. Glutathione is major, it's critical, and your body has to have it in order to fight oxidative stress. And what we know from this virus is that it comes in 2 phases. It's the infection phase, and then what we're seeing is the cytokine storm, the tremendous oxidative stress cytokine storm that tends to raise its ugly head at about day 9, at day 10. It can be off, give or take 1 or 2 days, but what we're seeing is huge cytokine storms of inflammation in that period of around day 10. And it's during this time, if we can support an individual with antioxidants to mitigate this oxidative stress, they stand a better chance of surviving this virus. So here's an example of a micronutrient test, and circled in red here, I've circled the area of the test where we're talking about the Spectrox and the Immunidex. And as you can see from this particular report, the Spectrox is very low normal in that middle yellow range, a value of 44. We really want it to be up around 80. The Immunidex is much worse even than that, down at 32. We can see that this patient immediately has areas for improvement. So then we go and we look at the individual nutrients and how they are measuring up. And here we're looking at glutathione. I've circled glutathione there with a gold colored box, and you can see the glutathione is markedly deficient. Markedly deficient. It is being used up faster than it can be made. We think that the rate limiting step for making glutathione is cysteine. If all the enzymes are working well, if all the cofactors are present, if we have the precursors and the other recipe ingredients to make glutathione. However, this particular patient, their glutathione is deficient and is having problems. And here are my recommendations. Giving glutathione is very, very helpful for combating oxidative stress. It helps to calm down the oxidative stress in the body. We can use either S-acetyl glutathione or liposomal glutathione. Those are the two forms of glutathione that we want to be using. For prevention, if someone is not infected and we just want to be boosting up our reserves in our body, for example, S-acetyl glutathione, a 100 milligram capsule twice a day for prevention would be appropriate. However, if someone is infected with the COVID-19 coronavirus, I would recommend taking S-acetyl glutathione, 100 milligrams per capsule, up to every 4 hours. Every 4 hours, round the clock, 6 doses a day. Again, because we need to pull out the stops to help control the oxidative stress of the cytokine storm. And glutathione is our major antioxidant that can do that. Let's move along to another example report here. Again, you see the Spectrox and the Immunidex, very, very low borderline. There's both sitting right on the level of being deficient. And so here I want to just pull your attention, circled in gold, to the vitamin D3 is deficient and the zinc is deficient. Both vitamin D3 and zinc are quite deficient here, which means that this individual's ability for antioxidant capacity and immune capacity is going to be challenged. It's going to be challenged without these nutrients. So let's take a closer look here. Vitamin D. Research has shown that vitamin D is safe and can protect against respiratory tract infections. This is a systematic review and meta-analysis of vitamin D research. And patients who were very vitamin D deficient and those not receiving bolus doses experienced the most benefit. So let's talk about what some of the dosing would be that I would recommend. If you've not been taking D3 and have a known deficiency, then I would recommend 50,000 international units twice a day for 3 days. Let me say that again. 50,000 international units twice a day for 3 days. This is if you've not been taking D3 and you have a known deficiency. Then on that 4th day, decrease your D3 down to the 5,000, 10,000 international units daily. Once we get into summer and good sunshine and get past this urgent need, we could even go down on the dose to 2,000 international units daily. If a person has already been taking D3 and they are not deficient, their levels are normal, then just continue the D3, 5,000 to 10,000 international units daily. If we are lucky enough to live in an area of full spectrum sunshine, such as in the southern United States, then 20 to 30 minutes of sun exposure, 40% of the body should be given, should be enough sun exposure to bring up our D3 levels. However, just another caveat, darker skinned individuals absorb vitamin D from sunshine more difficultly because of the pigment in the skin. So any of our patients that have more melanin in their skin should urgently be taking a vitamin D3 supplement if they have not been taking one, to make sure that their levels are satisfactory. So let's go on to another example. Spectrox and Immunidex are both in the borderline area, and in this report you can see vitamin A and zinc are deficient, two very well-known antioxidant and mineral needs for our antioxidant and immune capacity. So let's talk about these. What are the benefits of vitamin A? Here are just a few. I just want to highlight a few of these. It strengthens the immune system. It helps to protect against infections. It's needed to help children for proper growth and development. And there's been very strong research about vitamin A helping children, preventing children from obtaining deadly viruses like the measles virus. So we want our vitamin A levels to be strong. Here's a very nice study, vitamin A and immunity to viral, bacterial, and protozoan infections. Clinical studies suggest that vitamin A supplementation reduces morbidity and mortality in infectious diseases, such as I just mentioned, measles, diarrheal diseases, pneumonia, HIV, malaria, and in viruses. So vitamin A could be a huge tool for helping our patients. I want to put this in also this research study before you. The role of fat-soluble vitamin A and D in the pathogenesis of influenza. This is a very important paper, and in summary, I want to read this. The susceptibility, resistance and susceptibility depends upon the ratio of vitamin D to vitamin A. Decreased vitamin D to vitamin A can trigger viral activation and increase susceptibility to influenza virus. We're extrapolating, of course, from influenza virus to coronavirus with this, but it's very important that it's the ratio. We need good ratios of vitamin D and vitamin A. If our vitamin D is low and our vitamin A is high, this may worsen and increase our susceptibility to the virus. So what we need is adequate supplementation with vitamin D so that our vitamin A can also be protective. Let me say that again. We need good dosing of vitamin D so that our vitamin A can be protective. It's the ratio of vitamin D to vitamin A that we are finding is of significance. So how much vitamin A? We've talked about vitamin D, and a note about vitamin A. Retinol vitamin A is the active form of vitamin A in the liver. It is not beta carotene. Beta carotene can become vitamin A if our genetic enzymes are functioning appropriately. The BCMO enzyme is what converts beta carotene from carrots and spinach and our leafy greens to retinol vitamin A. However, 25% of people have genetic SNPs and they cannot convert their fresh squeezed carrot juice with beta carotene to retinol vitamin A. Particularly, those individuals need retinol vitamin A. And the recommendation here is for retinol vitamin A. 1,500 milligrams daily is what I recommend. 1,500 milligrams daily of retinol vitamin A. If someone is deficient in vitamin A, we can give increased doses, 10,000 milligrams daily for 3 days, but then decrease it back down to 1,500 milligrams daily. Again, particularly important when you're looking at those micronutrient tests, when someone's vitamin A on the test is deficient, and you know that they've been taking a good multivitamin and that they eat, a vegetarian diet, a lot of leafy greens and carrots. What that is saying is that they may have the genetic SNP and they cannot convert beta carotene to retinol vitamin A. So we need to come to their rescue with retinol vitamin A supplementation. So here, look at this next report. The Immunidex and the Spectrox are both in the deficient range. Look at that. This is a very onerous sign for this particular individual. And so immediately we start looking, what could be the correlation, the functional correlation that is happening with this patient? And indeed, look what we find. The zinc is so very, very low. So very, very low here. Even though some of these other nutrients are doing well, this zinc is so extremely serious. And let's look at some of the references of zinc. This is this article of the effects of zinc on respiratory syncytial virus, RSV virus. So again, a virus that affects the lungs. And what does this particular article say? It says that zinc supplementation decreases the morbidity of lower respiratory tract infections. It suggests that zinc will mediate the antiviral effect, causing the cell to support, decrease the effect of respiratory syncytial virus in the cell, decreasing the replication of the virus. So how would we dose zinc given this circumstance? Here is how I would dose it. For acute prevention, and we're talking about acute prevention, today, someone is not infected that we know of, but we want to get prepared because this is such a contagious virus. Zinc 20 to 30 milligrams once a day, and take it with food. Sometimes zinc taken on an empty stomach can cause nausea. So for acute prevention, zinc 20 to 30 milligrams once a day, taken with food. During active infection, I'm encouraging my patients to increase their zinc 20 to 30 milligrams twice a day, taken with food. After the infection is over with, decrease your dose again and balance with copper. The optimal zinc-copper ratio is approximately 12 to 15 milligrams zinc to copper. Again, optimal zinc-copper ratio is 12 to 15 milligrams of zinc to 1 milligram of copper. For someone that may be taking 50 to 60 milligrams of zinc per day, I would feel very comfortable giving 2 milligrams to 3 milligrams of copper. Again, for that ratio. Wildly high excessive zinc can lead to wildly lowered copper, and decreased copper can lead to neuropathy. We don't need that. In addition, many of the functions in the body, including SOD1 and SOD3 require zinc and copper both. So making sure that balance is important. Let's go on to this next particular report, and we see again the Spectrox and the Immunidex are borderline. This particular individual has some very interesting findings, but tonight I just want to draw our attention to the alpha lipoic acid. It's another individual antioxidant that can be supplemented along with the glutathione that this patient needs, along with the vitamin C that this patient needs, along with the vitamin D3 that this patient needs to help increase and improve their Spectrox and their Immunidex. And alpha lipoic acid is something that can be taken and can have an effect within the body within 3 to 4 hours. It's not a supplement that has to build up over time. It can be active immediately. So let's look a little bit more at alpha lipoic acid. Alpha lipoic acid reacts with reactive oxygen species, such as superoxide radicals, hydroxyl radicals, hydrogen peroxide radicals, singlet oxygen, and it protects membranes by helping our vitamin C and our glutathione, which then in turn can help recycle our vitamin E. So it's a domino effect. Alpha lipoic acid helps our vitamin C, helps our glutathione, that then helps our vitamin E. So let's talk about how much alpha lipoic acid. For prevention, alpha lipoic acid, 300 milligrams twice a day is an average dose. It has been approved in studies with prevention and treatment of macular degeneration and for helping with diabetic neuropathy, up to 600 milligrams twice a day on an ongoing basis. For COVID-19 infection, I'm asking my patients to consider alpha lipoic acid 300 milligrams every 4 hours. Again, it's to put a lid on the oxidative stress that this virus is causing, that is creating havoc throughout the body. So alpha lipoic acid, 300 milligrams every 4 hours. Let's turn our attention to vitamin C. I wanted to just put in, I couldn't resist putting in one small biochemistry chart here with vitamin C right here in the middle of how important it is for helping our vitamin E and our glutathione. All three major antioxidants. Vitamin C is so vital for that. So just a few words about vitamin C. Look at all the things it can do. It stimulates the production of white blood cells. It stimulates chemotaxis of the macrophages. It stimulates phagocytosis when they come up against some type of impurity. Activates natural killer cells. Very important for as an antihistamine, for example, with quercetin with this illness. I'm giving quercetin with vitamin C. Anyone that is infected, every 3 to 4 hours, the vitamin C helps the quercetin and it increases the production of interferon here. So just a very nice, colorful reminder of how vitally important vitamin C is in so many different areas of our health. So let's talk about dosing. There is evidence that vitamin C can be antiviral, directly antiviral. Frequent dosing is important because it's water soluble. So every 4 hours optimally. For prevention, if you're not sick, 1 gram twice a day is what I usually recommend for my patients, because once we get to more frequent dosing, compliance goes, downhill. So I encourage 1 gram twice a day of vitamin C for prevention. However, look at the dosing on this vitamin C if someone is infected with COVID-19 coronavirus. Vitamin C, 1 gram every hour to bowel tolerance. There are some of my colleagues that are saying, once you're infected, 1 gram every 30 minutes to an hour in order to prevent the oxidative stress. So vitamin C, 1 gram every hour to bowel tolerance if infected, particularly like in day 5 or 6 of the infection and onward, to help prevent the cytokine oxidative stress that this virus has been creating in people. And what does it mean to bowel tolerance? Massive doses of vitamin C in some individuals can cause diarrhea. So if someone gets softer stools, then you can back it off to 1 gram every 2 hours. Again, to bowel tolerance, but we need antioxidants every hour if somebody is in that cytokine storm. And so what I've done here is I've put all my recommendations on one chart. Now, these are only 6 of the nutrients from the micronutrient test, but they are 6 things that we could start today, that I could have started this morning with somebody, and it would have been helping them by tonight. These don't require massive amounts of time for intervention. So use this as your reference as you would desire. But I want to reiterate that I am speaking for SpectraCell because I use this micronutrient test for the benefit of my patients. But these recommendations have not been approved by the FDA. This is not a recommendation from SpectraCell, though I hope I have demonstrated how you can use this micronutrient test for the benefit of your patient and then make recommendations of appropriate dosing. By all means, as clinicians, your clinical judgment with knowledge of your patient must be paramount and supersedes whatever dosing recommendations that I have made as you examine the other factors involved, such as the quality, the concentration, active ingredients, and your patient's underlying conditions. And with that, I wish you well and stay safe, stay healthy, and until next time, thank you for using SpectraCell.